ankles, and toes. Okay, so those are the, and it's easiest for me to just go right down the line and do them that way. Now, what you want to do is make sure you cover all the movements for each one of the joints. Okay, for the shoulder, there's 4 movements. For the elbow, there's 3. For the wrist, there's 5. I think there's 5 for the fingers, okay? So if you haven't done 5 movements on a minimum, you probably have done them wrong, okay? You're leaving something out, let's put it that way. All right, so on the shoulder, again, you want to move smoothly, gently, slowly, and you're watching for any kind of pain in the face, or if they say anything, or if you meet resistance, you stop, okay? All right, so now on the arm here, and I guess I can do it on either side. Maybe you guys can see better. The bed should be flat, pillows, and I usually come like this, take a hold of the wrist, come here at the elbow, and you just bring this up and straight down. Okay, I'll show you in a minute. Okay, up and straight down. Now, I wouldn't do it from this position, but you're simply doing this. Okay, now again, full range is going to be way up as far as it'll go. Okay, so on somebody who can do this themselves, you may want to assist them to get it up high, because the farther you bring this up, the better for the full range of motion. Now, on an elderly person that is, not able to do this, and you're doing it, then you just, if it starts getting resistance, then you stop. Physical therapist, they might push it further, but they've had that kind of training to do that. The next movement, of course, you come straight up this way, okay? Straight up like that, which again is simply straight up, okay? The next movement is you're going to come across the chest like this, and, depending on the range, you need to push it over so that, and if you do this yourself, I can get so far, but then I need to push it, and sometimes your shoulder may pop a little bit. But that's getting that full range of motion, which if you have any kind of pain up in here, if you do that every day, it'll really help that. And then the last one is to bring the arm up even with the shoulder and rotate. This is actually rotating the ball joint inside when you do this. That's it. Okay, so that's the 4 for the shoulder.
Okay, so it's...
Yeah, like this, like this, like this, and like that. Okay. All right. So then you want to go to the elbow. There's actually 3 for the elbow, and this would be kind of silly. So you may want to say 2, but that's one movement. That's another movement. Okay. Okay, this is flexion, this is extension. Now you guys do not have to remember the names of what you're doing, just you have to do them, that's all. So that's 2 movements, flexion and extension. Then they have this other one, which is kind of called pronation. Okay, this is an elbow movement when you do this, and it involves both the bones down here, but the elbow is where you're kind of twisting it at. The way they want you to do that one is take the palm, bend it over, point it to the nose and toes, and you're doing the same thing. If you want to do it like this, you can. You're just twisting the arm, basically. But if you bend it here, it's kind of an easy way to twist it. And that's it for the elbow. Extension, flexion, pronation. You don't have to remember the names, you just have to do them. Now we're down to the wrist. Now, the wrist has 5. That's 3 right there. Okay? That's flexion, extension, and hyperextension. The wrist is one of the few joints that hyperextends. You've got more movement in your wrist than almost any other joint. Okay? So that's 3. Flexion, extension, hyperextension. Okay? Then you're going to move it side to side. Okay, and the wrist will move side to side, so you want to do that. Then we have one last one, which it's really hard to discern exactly what they're doing, but I've never had a student fail this, and here's what I'm going to tell you. This hand you hold the fingers, this hand you hold the thumb. You separate the thumb from the fingers, and you take the thumb and point it toward the toes, and then kind of bring it up toward the nose, like that. Okay, and that's the last one with the wrist. So we got do, and then well, I'm sorry. Got it? All right. Then we go to the fingers. Take the fingers and curl them over and in. Bring the fingers out, and you probably want to stretch them and pull them back, okay? Then you're going to take each one of the fingers. You're trying to hold 2 fingers in each hand if you can. Obviously, I do 4 and the thumb here. Spread them apart. I do these 2 and these 3. Spread them apart. Spread them apart. Spread them apart. Okay. And then you want to take each one of the fingers and touch it to the thumb, and then you want to bring the thumb over all the way across the palm and touch it over there to kind of stretch this joint out here. And that's it for the fingers. You're done. Woo! All right, so the